Good morning. I want to welcome you all to a special edition of the Future Farmers and Agricultural Specialists podcast. This episode will be dealing with the science of COVID-19 pandemic and the public and community health aspects of it.
This podcast is brought to you by Tuskegee University's College of Agriculture, Environment, and Nutrition Sciences, Tuskegee University Cooperative Extension Program, and Anchor FM. We're currently available on many platforms, including Apple Podcasts, Breaker Audio, Google Podcasts, Pocket Casts, Spotify, and Radio Public.
Our special guest today is Attorney Crystal James, who actually heads the Public Health Department here at Tuskegee University. At this time, I'll let Attorney James introduce herself and tell us a little bit about herself. Attorney James?
To give you a little bit of background, I'm actually a Southern girl born in Broxton, Georgia. That's rural Georgia. I received my Bachelor of Science degree in biology from Clark Atlanta University, a master's degree from Rollins School of Public Health at Emory with a focus on environmental and occupational health, and my Juris Doctorate or law degree from the University of Houston, and became barred to practice law in the state of Georgia. All of that by the age of 26. And so I did a lot of educating early and really looked at opportunities to where I could blend my science, law, and policy background together. My first real opportunity to do that came in 2000 when I started to work for the Council of State and Territory Epidemiologists. Now, for people who don't know what that is the organization of all state-based epidemiologists. And I was actually working for them when 9/11 happened. So I got an opportunity very early in my career to really look at how public health and emergency management kind of merged together. So in that role, I managed not only the day-to-day facets of some of the programmatic activities that were supported by the CDC, which included data analysis and indicator development, but also got an opportunity to supervise cross-functional teams and professional public health staff that evaluated legal decisions for impact on state-based programs. So some of the conversation that we see in the media today regarding state powers over federal powers when it comes to regulating for the benefit of the health of individuals is a lot of the work that I did early on. I also, later in my career, around 2008, had an opportunity to work at the Interdenominational Theological Center in the Institute for Faith Health Leadership under the guidance of Dr. Raymon, who's now also with us here at Tuskegee University as the director of the Bioethics Center. But I was the Pandemic Influenza and Emergency Preparedness Coordinator at ITC. And so I maintain accountability for directing and planning the management of ITC's pandemic influenza preparedness activities, because that's when pan flu was a really hot issue, and a lot of strategies around doing tabletop exercises and how do we get communities prepared, especially Black communities and the Black church. So we spearheaded the successful integration of public education materials and awareness programs across Atlanta University Center schools, but also did some of that training inside of some of the largest churches around the country. So in my roles as the head of the Department of Graduate Public Health, I also teach courses such as Introduction to Environmental Health Sciences, Public Health Administration, Policy and Law, as well as leadership and emergency management, which are all very relevant to the conversation we're having here today.
The first thing that I would like to ask you is just to give our listeners a general introduction into what is COVID-19.
Okay, so as we all know, CDC is responding to an outbreak of respiratory disease caused by a novel, which means new, coronavirus that was first detected in China and which has now been designated as a pandemic because it is widespread in many different countries internationally, including the United States. Coronaviruses are a large family of viruses that are common in people and many different species of animals, including camels, cattle, bats, and cats. Rarely, these animal coronaviruses are zoonotic, which means they simply can affect people too, and they spread between people. And we've had instances of this in the recent past, such as MERS-CoV, SARS-CoV, and now with this new virus named SARS-CoV-2, which causes the COVID-19 disease. And it has been it is called that because the name is coronavirus disease 2019, and the abbreviation is COVID-19. And so that's how we get to COVID-19, but it is a SARS family coronavirus that is actually caused the huge outbreak and pandemic that the world is experiencing right now today.
So I would like to ask, how much does public health, either academically or with respect to the role that it plays in government and communities, how does it play a critical role to this and other crises?
Okay, well, public health plays a role in this pandemic, mainly due to the community spread, which means some people have been infected and it's not known how or where they became exposed. When we first started to hear about the disease, it was postulated that it required direct physical contact with someone who had been to or recently resided in Wuhan, China. But because of the communicable nature of the spread of disease, and the disease basic mitigation efforts from the public health workforce became more essential. These methods that epidemiologists and other public health professionals typically deploy, such as contact tracing, which is widely used in the HIV/AIDS epidemic, and it's also commonly used for other sexually transmitted illnesses and foodborne illnesses as well. What is more publicized at this time, and as will become even more so as the emergency situation continues to unfold, are the skills that public health professionals have in collecting and analysis of population-based data. Now, how you're seeing that data on nightly news cycle, which is in basic numbers of persons tested, positive cases, deaths, and recovery, are validated and republished will largely be based on people in public health and how they validate that data. And there's a whole process for that. Understanding these strategies and tools commonly used in public health, as well as emergency management skills such as mitigation, crisis management, leadership and influencing, as well as effective communication, are all critically important to handling issues that are very clear now in our community through the pandemic.
If someone were to look at Tuskegee's website or talk to students and or faculty, they would see that public health has a major role to play at the university, as there's quite a few professionals with experience in that area. And I've also noticed that our acting president, Dr. Ruby Perry, has taken critical action in response. Can you talk a little bit about the university's response as a whole to the COVID-19 pandemic?
Well, we were very lucky that having acting president Perry be in her position at this time as a veterinarian herself. She's very much aware of the One Health concept or the One Health strategy that we spend a lot of time talking about in the College of Veterinary Medicine, and that is the interaction between animal health, human health, and the environment, and how diseases such as this virus can have some very detrimental effects if they are not contained. And so her background and experience led us to start very early, and I think earlier than many institutions of our kind did, way back in February, before it started to become a panic. We had already started to have conversations even in late January about what the flu precautions should be on our campus. By March 3rd, the Community Health Task Force had been established by the acting president, and we had really started to think about what do we need to do to keep our campus safe, as well as to make sure that we are good citizens in the community at large. And so I think the university has been proactive from the very beginning, and making sure that we look at not only how do we manage our students on campus and during the break period of spring break, but what are our choices for our faculty and our staff. We have the pleasure and distinction of having some faculty and staff that have been with us for quite some time, but also many of them fall into those vulnerable categories that have been well publicized through the CDC's website because of their age or some underlying health issues that they may have experienced prior to this outbreak. And so we had a task force that were thinking about these things, not only administratively, how the university should respond, but also how we can make sure that we take care of our human resource as well.
In that same vein, and talking about the university's response, what are some of the primary threats to the campus community regarding community spread?
Well, the primary threats that are facing the university are very similar to the community at large, in that they will be continue to be persons who are carriers of the disease that are asymptomatic. These persons, if we don't take all universal precautions, may infect countless other people who may be vulnerable and have very severe symptoms up to and including death. Acting President has just instituted the Public Health Advisory Committee, which I co-lead with Dr. Reuben Warren, to assist the Office of the President, which includes her cabinet, to develop strategies and action plans as we move into the next phase of emergency management, out of mitigation into the preparedness for summer and fall activities on the campus. And so we are continually being involved not only in committees on campus, but I have been designated by the president to serve in her place when she could not attend, and many times she has attended on her own in many of these same types of committees that are happening in the Macon County and in the city of Tuskegee. We have been very active in their response community committees as well, to ensure that we are coordinated in what's going on with the local education department with K through 12, as well as the local first responders. And so these primary threats that we have, because we do have students that are coming in from all over the United States and from many different countries. And we do have programs where they have travel abroad programs where some of them may have been exposed. So we definitely know that those types of things will have to be limited in the short-term future. And we're looking at how we can continue to be a resource to the community at large in which we sit.
In times when we sometimes hear a lot of criticism about the town-gown relationship, it's been clearly demonstrated by the Tuskegee community and the university that in these challenging times, we are definitely one. We appreciate you all's work. Another question I would like to ask is for people who may think that they've been exposed to COVID-19 or think that they may have some symptoms. What should their plan of action be?
Are you talking about on the university or campus or in Macon County at large?
I would say both. Can you start with the university and then speak to the larger community?
Okay, so the Community Health Task Force did a lot of work initially to establish some protocols for our students who may be exhibiting cold or flu symptoms. They should contact Student Health Services immediately, and they all have that number and information. They should call them first, and they will be triaged over the phone and given instructions about and given a specific time they can come in for further assistance, so that they're not in the waiting room possibly contaminating other individuals who might be there for different services. They will be provided a mask as soon as they've arrived to Student Health Services to proceed with their evaluation. And the health services will contact Alabama Department of Health for further instructions once they have been triaged at our health services center on campus. So if a student is exhibiting 100-degree temperature or higher, or shortness of breath, or difficulty breathing, they should call East Alabama or Auburn Opelika Medical Center, and we provide the number for them too for further direction, because we do not have a doctor on staff all the time at Student Health Services. If they are already exhibiting these types of symptoms, then they should be looking to get to some hospital services. For employees, we have a very similar type of protocol that we've established to put in place. First of all, if you are feeling like you have these symptoms and you have not reported to work, and this was before we actually moved to to comply with the governor's stay-at-home policy. But once we actually do start to come back on campus, you should first of all not come in. Let your supervisor know that you are feeling ill, and if your symptoms are severe enough to be granted a test, then you should definitely notify your supervisor and then self-quarantine for at least 14 days or until you're released back to work by a physician. If that person have been in areas with other employees, then that unit will be advised that they should also be tested, and proper sanitizing procedures will be taking place by facilities to ensure that the workspace has been sanitized before the rest employees are able to go back into that immediate area where the person, if they are deemed to be positive, have been sitting. And there is a list of a chain of command of their unit employees that will be contacted once that immediate supervisor learns of the positive test. Then they would alert their supervisors as well, so that we can again engage all those different pieces on our campus through facilities and emergency management to secure not only the area but the building, ensure that it's properly sanitized and no further spread, potential spread could be eliminated. So in the community at large, the same type of thing, it definitely applies. If you are feeling ill, if you think that you are having flu-like symptoms, you should definitely call your healthcare provider. I know that there is a fairly qualified health center in Macon County that is currently doing testing. And so they should call that entity and let them know what their symptoms are, and be given an opportunity or a time that they could come in for testing if their symptoms and underlying conditions meet the protocols for testing.
There's been a lot of talk about the racial disparity and actually who is dying from the pandemic. And people have spoke a lot to Black and Brown communities suffering a lot more. Could you please enlighten us a little bit more about that?
Well, what I can share with you, and we're actually going to have some experts that are much better at data analysis than myself in a community town hall meeting that we're going to host via Zoom later this afternoon at 6:00. So definitely feel free to join us for that. But the main issue is that because health disparities that we have are well documented in the United States tend to impact communities of color much more, the underlying illnesses that tend to cause more severe illness are more prevalent in our communities, in Black and Brown communities. So we tend to have more diabetes and hypertension and heart disease, lung disease, those things that with this particular virus actually will make you more likely to have a severe symptoms and more likely lead to death. And so that's what we're seeing play out with this, with the dramatic numbers you see in places like Chicago and in New Orleans, where you have over 70% of the positive cases have resulted in death in the Black community. It is another part of that data, and one of the things we plan to unpack this afternoon is also the fact that not many people in the African American community have been tested, so that it looks way more exacerbated in some points because many people are being turned away for testing. I have a good friend who is a first responder as a police officer, and was actually known that someone in this office was positive, and he was initially denied for testing. And so, because we don't have enough baseline tests, the people that are usually getting tests are severely ill. And unfortunately, because many people in the Black community also have a lot of these comorbidities or these underlying illnesses that make them more susceptible to the severe symptoms, that's why we're seeing a over abundance of deaths or excess deaths, if you will, in the Black community.
Thank you so much, Attorney James. I would like to thank you not just for participating with us here today, but for your leadership during these challenging times. Is there anything that you would like to leave with the audience before we sign out?
Well, the only thing that I would like to add is that as a university community, we have a lot of talented people that are lending their skills to this fight. I have the pleasure of being able to have a leadership role in some of these spaces, but I do just want to share here that even though I am working hard on this every day, there are a lot of people at the university that are working hard and thinking about what can we do to not only make sure that we protect the campus, but we are also good community members in the community at large. And so we are consistently trying to strategize with our local health department as well as with the Alabama Department of Public Health to see how we as a university can be of assistance in this fight. Because it is a fight and it is one that is going to continue on. I would also caution folks in the Black community, especially, is if you know that you have some of these underlying illnesses that we mentioned earlier, and this push that people want to go back to work, and I understand it, that food, shelter, and clothing are basic necessities, and when you're out of work, there is a stretch, but your life is very much at risk if you rush back into an space where you could be exposed to this illness. So if you can stay home, stay home. And I know it's difficult if you're used to being active and being out. The one thing I say, you can walk around in your community. You can exercise. You can sit out on your porch. It's not like you got to sit in a dark room by yourself. But you do want to make sure that you're social distancing. And with that, we want to make sure that we're not social isolating. Some people that may be living alone, may be widowed or divorced or just unmarried, and they are by themselves. We need to check on each other and check in with each other, even if it's a wave on the porch, just to have some connection. Because the other thing that is very serious, I want to say side effect of this order to stay home, is that we now have a lot more mental health issues that people are dealing with, and depression, and also the anxiety of constantly seeing all the bad news that we see regarding the deaths, especially deaths in our communities. So I just want to let people know that there are opportunities that through telemedicine that you can reach out to a mental health provider. There are opportunities through some of our churches and other local groups to engage in an online platform or even in just a calling tree. Any of those opportunities that you can use to try to help out those people who may be more vulnerable, helping them to get their groceries, other things that they can do so they don't have to be out and be subject to exposure. Those are some of the things that all of us can do, whether you're in the university or in the community or anywhere, to help make sure that we as a community survive this pandemic with the least amount of deaths and severe illness.